Sponsored by RxCardClub.com. Get a free prescription drug card and save up to 85% on prescription drugs. RxCardClub.com. How effective is Rebif for MS? Rebif, interferon beta 1a, is an injectable medication that may be used to treat relapsing forms of multiple sclerosis, MS. Its effectiveness was evaluated in clinical studies based on the number of exacerbations, flare-ups. Its effects on disease progression and MRI findings were also studied. Results showed that injecting 22 micrograms or 44 micrograms 3 times a week reduced the number of exacerbations compared to placebo, no active medication. Results from Study 1. Rebif 22 micrograms 3 times a week reduced MS exacerbations by 29% over 2 years. Rebif 44 micrograms 3 times a week reduced MS exacerbations by 32% over 2 years. 25% of patients taking 22 micrograms of Rebif 3 times a week did not have a flare-up at 2 years, compared to 32% of patients taking the 44 micrograms dose and 15% of patients taking a placebo. The median time to first MS exacerbation was 7.6 months in patients taking Rebif 22 micrograms and 9.6 months for patients taking Rebif 44 micrograms. This is compared to 4.5 months for those taking a placebo. MRI PDT 2 lesions were reduced by 1.2% for the 22 micrograms group and 3.8% for the 44 micrograms group after 2 years. This is compared to an increase in MRI PDT2 lesions of 11% seen in the placebo group. Results from Study 2, 75% of patients taking Rebif 44 micrograms were relapse-free at 24 weeks, compared to 63% of patients taking Avonex 30 micrograms, at 48 weeks. 62% of patients taking Rebif 44 micrograms and 52% of patients taking Avonex 30 micrograms were relapse-free. Patients taking Rebif 44 micrograms had less MRI lesions during 24 weeks of treatment compared to patients taking Avonex 30 micrograms, RxCardClub.com. Get a free prescription drug card and save up to 80% on prescription drugs.